And then that's when you get into bleeding, injury to other structures and other things. And it just kind of like becomes like a snowball effect that you can't get out of.
I mean, I only did like hurt for 2 months, so I just.
Thing like at UVA. How did they decide that you were supposed to just go out? Sorry. A little bit more sooner, I think we kind of have seen a little bit more of how each other does. Mine, I mean, I just don't know. I don't know.
Drops really fun.
But just the
Sound
I don't know that her reaction. Here.
I was like, go back to the M&M.
I have to ask.
I did.
I know.
Hey everybody, if we could go ahead and get seated, we'll get started. All right, so today I have the privilege of introducing Dr. Mark Anthony Fleming II. Marky was born and raised in the island of St. Kitts and came to America when he was finishing up high school. He completed his undergraduate studies at Berry College in Rome, Georgia, kind of close to Tennessee if you don't know where that is. And from there went on to the University of Connecticut to earn his MD. During his time here at UVA, Marky has earned many awards. Most recently, he is the recipient of the 2023 Jameson L. Chasen Professionalism in General Surgery Award that is provided to one resident from the American College of Surgeons. Also, some other awards that he has received, the Kurt G. Tribble Award for resident teaching in 2019, the Arnold P. Gold Resident Humanism and Excellence in Teaching Award in 2023. Also, he's a winner of the Bigger Layman Award from the Virginia chapter of American College of Surgeons. I can't talk about Marky without talking about his dedication to diversity and inclusion, which has inspired me to combat the struggles faced by many Americans. He played an instrumental role in the creation of the House Staff Council for Diversity and Inclusion, which we all know as the HCDI. He was the inaugural president and has continued to be involved since its inception in 2017 after the terrible events of August 12th. Through the HCDI, Marky has developed community outreach programs, raised funds for STEM box creation, which served hundreds of elementary and middle school students throughout the county, and continually feed those within our community who have the most need, which we all as a department were reminded of with the food drive that he sponsored for the Martin Luther King Day. All of these altruistic attributes were recognized by the health system as he was the recipient of the 2021 Martin Luther King Jr. Health System Award as well. Marky helped spearhead the movement, which resulted in MLK Day being recognized as a holiday within our institution. Marky continually excels in academics and is well published. He continues to serve the community, mentors both residents and medical students, while also being a husband to his lovely wife and my dear friend, Dr. Candace Fleming, and a new father to their beautiful son, Mark Fleming III, which we all know as Trey. So please join me in welcoming my dear friend, Dr. Mark Fleming, as he gives his grand rounds titled, My Surgical Giants, If I Could Walk a Mile.
Good morning, everyone. How y'all doing this morning? Good? In Black culture, we usually say good morning back, and we say, how y'all doing? All right, good. All right, so it's good to see all of you as usual. You know, it's been a while. It's wild to think that just 6.5 years ago, I was sitting in that back row there, watching Dr. Brandy Edwards talk to us about why p-values were a scam. It's truly a privilege to stand up here in front of you, influenced by each and every one of you in some way, whether it was personally or professionally, no matter how brief. And I'd just like to say that I'm extremely grateful for my time here and the excellent support, sponsorship, and most importantly, surgical training that I've received. So this morning, I'd like to talk to you about my surgical giants. Throughout my residency career, I've sat in this room and listened to a handful of talks on surgical giants, and I always wondered why I was left wanting to know more and feeling somewhat frustrated by the fact that none of the surgical giants described looked like me. While I was impressed by the accomplishments of people like Dr. Michael DeBakey and Dr. William Halstead, I couldn't help but struggle to identify myself in them, especially knowing the time periods during which a lot of these giants lived and trained, when many people who looked like me were still enslaved and didn't have basic human rights. This talk was inspired by a grand rounds presentation to UVA's radiology department in April of last year. There was a few of us who attended, mostly Black residents, myself, Eric, Chioma, I think Jason was there, I know Dr. Sean was there for sure. And it was a talk that was given by Dr. Edward Cornwell III, a trauma surgeon and modern surgical giant in his own right, and former chairman of the Department of Surgery at Howard University Medical College. And when we heard that Dr. Cornwell was coming, we knew we had to attend and sit in the presence of greatness. And I'm so happy that I did. A lot of the information and photos I'm going to share with you today is publicly available online. And there's some finer details to some of their stories that I learned from Dr. Cornwell's talk, which will make it all that more intriguing. The radiology department actually has Dr. Cornwell's talk recording online if you wanted to search that. Today I have three main objectives. One is to highlight the contributions and stories of Black surgical giants dating all the way back to the early 19th century, and moving forward in chronological order to some of the more modern giants that we've all grown to love, including one of them who's coming to give us grand rounds next week. I will also reflect on lessons learned from these giants and those who came before me, and share my story throughout to give you a glimpse into other aspects of my life that you may or may not know about. I have no disclosures. So for me, this is where it all started. I was born and raised in St. Kitts and Nevis, and these are just some representative photos of my childhood. Come from humble beginnings, but had a very exciting childhood. And you know, this picture here with the truck, that was my favorite truck. We actually still have it in the storeroom, and hopefully Trey will get to drive it one day. And then this is my family on the far right there, just some younger photos of us. The first giant I would like to talk about is Dr. Martin Robinson Delaney. Dr. Martin Delaney was born in 1812 in Charlestown, Virginia, which is now West Virginia, to a free mother who was a seamstress and an enslaved father who was a carpenter. He was an African-American abolitionist, writer, physician, and the first African-American to serve as a field officer in the U.S. Army. In order to prevent his own enslavement, Delaney's mother took him and his siblings to Chambersburg, Pennsylvania in 1822. At the time, it was illegal for enslaved people and their descendants to learn how to read and write in the state of Virginia, and they would have undergone persecution had they stayed. His father, Samuel, later bought his freedom and joined them. Prior to 1850, it was not necessary to be certified in medicine to practice medicine. So Dr. Delaney initially did an apprenticeship with a physician in Pittsburgh in 1833 before opening a successful medical practice on cupping and leeching. It is said that he journeyed over 160 miles west on foot to Pittsburgh for this apprenticeship and to also study Latin, Greek, and the classics. He was a husband to Catherine Richards and a father to two children, to Saint Delaney and Alexandra Delaney. In 1850, he officially enrolled in Harvard Medical School as one of 3 Black students in an attempt to finish his formal education, medical education. However, he was dismissed from the institution after only 3 weeks as a result of petitions to the school from white students, and ultimately moved to Canada in 1856 to continue his medical practice. Although he had worked with the likes of Frederick Douglass, a well-known abolitionist at the time, to write and promote the North Star, a 19th century anti-slavery newspaper based in Rochester, New York, Dr. Delaney's experience at Harvard Medical School was one of the main reasons he later published one of his greatest works entitled The Condition, Elevation, Immigration, and Destiny of the Colored People of the United States, Politically Considered, calling for the immigration of Black people back to Africa as the only solution to the current anti-Black climate in the US. He even led an emigration commission to West Africa to explore possible sites along the Niger River in 1859, claiming, "We are a nation within a nation, we must go from our oppressors." This was viewed as a decisive break from mainstream abolitionism, as he wrote in a letter to William Lloyd Garrison, a prominent abolitionist at the time, and I quote, I should be willing to remain in this country, fighting and struggling on the good fight of faith. But I must admit that I have not hopes in this country, no confidence in the American people, with a few excellent exceptions. This quote in particular really resonates with me because I can't tell you how many times I've felt like this since starting residency. How many times I just wanted to pick up and move back home and call it quits, having no confidence in the American people. It has been one heck of a ride for us as we navigated the Unite the Right rally, the death of George Floyd, Breonna Taylor, Ahmaud Arbery, Tamir Rice, Freddie Gray, Elijah McClain, Jacob Blake, Dante Wright, Tatiana Jefferson, Botham Jean, my Caribbean brother, and countless others. Let's not forget their names, say their names. And somehow as Black people, we continue to thrive and fight the good fight for those who will come behind us because of excellent exceptions, like some of you in this room who actively supported me and my Black co-residents through it all. Anyway, when the Civil War began in 1861, Dr. Delaney returned to the US to persuade President Lincoln to create an all-Black corps led by Black officers for the Union Army. He was therefore appointed as a major in the 52nd US Colored Troops, making him the first line officer and surgeon in US Army history. After the war and during the Reconstruction era, Dr. Delaney moved to South Carolina and became a big proponent of Black pride, the enforcement of Black civil rights, and land for previously enslaved people. He briefly served as a judge in Charleston, South Carolina, before moving to Boston and then ultimately to Xenia, Ohio, where he died on January 12, 1885. He is considered by many the father of Black nationalism and has been invoked primarily as the dark binary opposite of more moderate figures like Frederick Douglass and Martin Luther King Jr. Dr. James Smith was one of the most broadly accomplished Black intellectuals and activists in America during his time. He was born on April 18, 1813 in New York to a mother who had purchased her own freedom. It is unclear whether or not his father had been a freed slave or a white merchant. Growing up, he attended the African Free School in New York City, a school founded in 1787 by the New York Manumission Society with the purpose of educating the children of free and enslaved Black people. After gaining his freedom in 1827 due to the New York Emancipation Act, Dr. Smith graduated the free school at age 15. Unfortunately, he was denied admission to several American colleges upon graduation. Many historians believe that Smith was extremely bright in grade school, and at the age of 11, he was chosen to deliver an address to General Marquis de Lafayette, a French aristocrat and military officer who supported George Washington during the American Revolutionary War. Dr. Smith ended up raising money to attend the University of Glasgow in Scotland for 5 years, where he completed a bachelor's and a master's degree in quantitative public health and statistics, and then obtained his medical degree in 1837. Dr. Smith had a wife and 5 children. As far as we can tell, he was the first Black American to be awarded a true medical degree. He returned to New York City after completing his medical internship in Paris, France, and opened a medical office and the first Black-owned pharmacy, which historians say attracted both Black and white clientele on West Broadway. Given his advanced education, Smith was instrumental in advocating against anti-pseudoscience permeating American views on race and medicine. More specifically, he spoke against phrenology, the pseudoscientific and racist idea that head shape was indicative of intelligence among racial groups. And he also rebutted point by point the claims of Black inferiority by our very own Thomas Jefferson in his notes on the state of Virginia. Like most Black intellects of that time, Dr. Smith emerged as a powerful anti-slavery and anti-racism organizer, orator, and writer. Like Dr. Delaney, he also worked with Frederick Douglass and established the National Council of the Colored People. He wrote about medicine, science, education, racism, and literature. And in fact, his most famous work was the introduction to Frederick Douglass's My Bondage and My Freedom. In 1863, he was appointed as professor of anthropology at Wilberforce College and moved to Ohio, where he eventually died of heart disease at the age of 52 on November 17, 1865. One of Dr. Smith's most famous quotes stated, "Freedom and liberty are not synonyms. Freedom is the gift of God, liberty the creature of society. Liberty may be taken away from a man, but on whatsoever soul freedom may alight, the course of the soul is thenceforth onward and upward." Next is Dr. Alexander T. Augusta. When I think of Dr. Augusta, I think of perseverance, something I've had to do a lot of along my journey, and I know that perseverance is not unfamiliar to a room full of surgeons. In 1825, Dr. Augusta was born in Norfolk, Virginia, to free Black American parents. Although he didn't get into medical school at the University of Pennsylvania because he was Black, a faculty member took interest in him and taught him privately. As he continued to pursue formal acceptance into medical school, he worked as a barber in Baltimore, Maryland, and in 1847 got married to his wife, Mary Burgoyne, a Native American. He was finally accepted into the medical college at the University of Toronto in 1850, and him and his wife moved to Canada. After completing his medical training in 1856, he was appointed as head of the Toronto City Hospital and was also put in charge of an industrial school. However, in April 1863, during the American Civil War, and much like Dr. Martin Delany, Dr. Augusta was commissioned as a major in the Union Army, the first of 8 other Black officers in the Civil War, and appointed head surgeon in the 7th U.S. Colored Infantry. He got paid a whopping $7 per month, a salary that was much lower than that of his white privates. But Dr. Augusta decided to write Massachusetts Senator Henry Wilson and got his pay raised to the level of white commissioned officers. Unfortunately, Dr. Augusta became a victim of violence after he was mobbed in Baltimore for wearing his officer's uniform. Nonetheless, he overcame that and wrote to President Lincoln to request protection for him and other Black soldiers and their families because of the hostility he was receiving from his white assistants who complained about being subordinate to a Black officer. Imagine you could just write to the US president back in the day. Wish we could do that today. Got a lot of things to say. So he eventually moved out of Baltimore and was placed in charge of the Freedmen's Hospital at Camp Barker near Washington, D.C. by President Lincoln. And in 1865, he was ultimately promoted to lieutenant colonel, which made him the highest ranking Black officer in the US military at the time. Unfortunately, his existence as a Black surgical leader continued to threaten his white counterparts. And 1 year later, in 1866, he was involuntarily pushed out of service. After his military service, he spent some time in charge of the Lincoln Hospital in Savannah, Georgia, for a couple of years before starting his own practice in DC. Dr. Augusta went on to become the first Black medical professor at the newly formed Medical College of Howard University and remained there until 1877. Although he was denied recognition as a physician by the American Medical Association, he helped make Howard University a success and encouraged the young Black medical students he came across to persevere no matter what. Dr. Alexander Augusta died in Washington, D.C. in 1890 and was the first Black officer to be buried in Arlington National Cemetery. These next set of pictures encapsulate my journey from St. Kitts to Georgia. So that first picture on the left is probably one of the last family photos we took when I was about 16 years old, right before moving to Lilburn, Georgia in 2008. And then I did a year of high school, and during that year stayed with my guardian parents who were like family. That's Aunt Michelle and Dave, her now ex-husband. And I had graduated senior year of high school in Lilburn before going on to Berry College. And that's a picture of all of us there, including Rosie, their daughter, and my sister in 2013 when I graduated Berry. That entire journey over those 5 years in Georgia was tough in many ways. Some of which, I can't get into too many details on this podium, but it was a struggle. And, I had the support of my family, both my guardian parents and my immediate family. And so we were able to make it through, but I had to work a lot of jobs, struggled financially, adopted my brother during college so that he can come out and also pursue his education. But, all in all, I think I'm just grateful for the support that these people provided me and all the other people I met along that journey. And so that's why I'm so passionate about giving back and making sure to look out for folks who are coming behind me, because I had people do that out of the kindness of their hearts. This next gentleman needs no introduction to most of us, especially our TCV folks. Dr. Daniel Hale Williams, the son of a barber, was born in 1858 in Hollidaysburg, Pennsylvania, as the 5th of 7 children. His mother was called Sarah Price Williams and was the primary caretaker of the family, especially after his father died. Dr. Daniel initially started off as a shoemaker, but knew almost immediately that he wanted to pursue higher education. After completing secondary school in Wisconsin, young Daniel Williams did an apprenticeship with the former Surgeon General for Wisconsin and eventually studied medicine at the Chicago Medical College. He spent his early medical career running a private practice in an integrated neighborhood in Southside Chicago. He taught anatomy at Chicago Medical College and served as surgeon to the City Railway Company. And in 1889, he was appointed to the State's Board of Health by the Illinois governor. Given his influence, Dr. Williams was determined to establish an integrated hospital in Chicago where both Black and white doctors could study and where Black nurses could receive training. After a lot of rallying, he opened Provident Hospital and Training School for Nurses in May 1891, the country's first interracial hospital and nursing school. And if this wasn't impressive enough, Dr. Daniel Hale Williams' biggest claim to fame was that he performed the world's first successful heart surgery in 1893. On a hot summer night in Chicago, a young male was stabbed in the chest and rushed to Provident Hospital. When he began to go into shock, Dr. Williams suspected that he had a deeper injury near his heart. In a cramped operating room with crude anesthesia, Dr. Williams inspected the wound between two ribs, exposed the breastbone, cut the rib cartilage, and created a small trapdoor to the heart, relieving the tamponade. He did this with 6 doctors observing him, 4 white and 2 Black. With adequate exposure, he was able to suture ligate the damaged left internal mammary artery. Upon further inspection, he saw that the knife had gashed the right coronary artery, and with the heart beating and no transfusion available, Dr. Williams rinsed the wound with saline and repaired the right coronary artery on a beating heart. 51 days after a lethal injury to the chest, James Cornish, the young Chicagoan, walked out of the hospital and lived for over 20 years after his surgery. Like many of the Black surgical giants you'll hear about today, you'll recognize a recurring theme in that they all worked at or held chief positions at Freedman's Hospital in Washington, D.C. This is because Freedman's was the first hospital of its kind to aid in the medical treatment of former slaves and was founded in 1862. Later, it became the major hospital for the African-American community in Washington, D.C., and 6 years after being founded, it became the teaching hospital for Howard University Medical College. So in 1894, Dr. Williams became chief surgeon of Freedman's Hospital, the most prestigious medical post available to Black Americans at that time. Other major contributions by Dr. Daniel Hale Williams included the fact that he helped to organize the National Medical Association for Black professionals in 1859 because we were barred from the American Medical Association. In 1913, he became the first Black American to be inducted into the American College of Surgeons. In the words of his colleague, Dr. Daniel Hale Williams' greatest pride was that directly or indirectly, he had a hand in the making of most of the outstanding Negro surgeons of the current generation. I also think this quote listed on the screen speaks to me as it relates to my passion for medical and social justice and equity and all the work I've done here, in the sense that if as a country, if as an institution, and if as a physician or a surgeon, we don't make provisions for our own sick and suffering, then are we truly worthy of civilization? Are we truly worthy of all the accolades and honors that we bestow upon ourselves? If we don't recognize the human aspect of our patients and the psychosocial barriers that hinder their care over and over, then what are we truly worthy of? In all of his glory, Dr. Daniel Hale Williams died in 1931 and is commemorated in many ways in DC and at Howard University. There's a Daniel Hale Williams Medical Reading Club in DC, and Code Blue at Howard is still called a Dr. Dan. And even here at UVA undergrad, there's the Daniel Hale Williams Pre-Medical Society that I've had the opportunity to go and speak to a couple of times and help connect those students to mentors and research opportunities within our own department. Next, we have Dr. Matilda Arabella Evans, the first American woman, Black or white, licensed to practice medicine in South Carolina. She was born in 1872 to Anderson and Harriet Evans of Aiken, South Carolina. Immediately, Dr. Evans excelled in her schooling and was encouraged by the founder of her industrial school, Martha Schofield, to enroll in Oberlin College in Ohio, which she attended on a scholarship for almost 4 years. Just prior to graduation, Dr. Evans left college in 1891 to pursue her medical career. She did a couple of years of teaching at the Haynes Institute in Georgia, as well as at her alma mater, Schofield Industrial School, before enrolling at the Women's Medical College of Pennsylvania in 1893. She then returned to Columbia, South Carolina in 1897 after graduating with her MD and established a successful practice as the first Black American woman licensed to practice medicine in South Carolina. Dr. Evans treated both white and Black patients and practiced surgery, gynecology, and obstetrics. She initially cared for patients in her own home until she established the first Black hospital in the city of Columbia, Taylor Lane Hospital, in 1901. Dr. Evans was known as a huge public health advocate, and her survey of Black school children's health in Columbia, South Carolina, served as the basis for a permanent examination program within the South Carolina public school system. She founded the Columbia Clinic Association, which provided health education and services to families, and then extended that same program through her establishment of the Negro Health Association of South Carolina, which educated families throughout the state on proper healthcare procedures. If that wasn't impressive enough, Dr. Evans opened another hospital in 1914 called St. Luke's Hospital and Evans Sanatorium, where she trained Black nurses and physicians, and in 1930, just 5 years before her death, established the city's first free health clinic for African-American children, which saw over 3,500 patients in its first 3 months. She also ran her own farm, founded a weekly newspaper called the Negro Health Journal of South Carolina, and offered a program of recreational activities for underprivileged boys. The more I read about Dr. Evans, the more I thought to myself, I have very little right to complain about how busy I am during residency. Her entire career and accomplishments could summarize that of multiple physicians in today's time. And if you think that's all she did, you should also know that Dr. Evans was elected president of the Palmetto State Medical Society, was vice president of the National Medical Association, and served her country during World War I when she was appointed to the Volunteer Medical Service Corps. Just a complete powerhouse. And I know we talk a lot about this idea of triple threat academic surgeons in today's time as the archetype, right? Well, I think Dr. Evans encompassed that and so much more, because she not only focused on being successful within the walls of academia or a hospital, but she focused on the betterment of her community. And that's where I think the true power lies. I came across this quote from a letter she wrote to the Bursar Women's Medical College of Pennsylvania on behalf of a young Black woman she had sponsored, but who needed scholarship assistance. And I quote, "I have done well and have a very large practice among all classes of people. I've had unlimited success. Since I've returned to my native state, others have been inspired and have gone on to our beloved college to take degrees." And this, I think, encapsulates her view on the success she had and the work she did, and something that still rings true today among a lot of us Black surgeons and professionals in general. We understand how important and critical it is to look out for our neighbors and sponsor those junior residents and students coming up behind us so that they too can achieve greatness. These next pictures show me going back to St. Kitts as a Bonner Scholar during college. I was a Bonner Scholar for all 4 years, and it was a scholarship awarded to students who demonstrated a heart for service upon applying to Berry. And basically, we had to volunteer and do community service for 10 hours a week, all 4 years of college, while attending classes, while holding an on-campus job as well that actually paid us, and then do two summers, 280 hours of service. So a lot of service and a lot of reflection and a lot of understanding, what people are dealing with in the community, especially for me who was an immigrant at the time and, needing to understand the context within America. So this is me working in the blood bank on the top right there. And then I also did some work in the pharmacy. And the white male in the bottom right picture is a friend from college. He was a fellow Bonner who went down with me. And then the one in the middle is a very close friend from childhood who was also my neighbor. And then that bottom picture there with us in the blue uniform, that's actually the activities board that I was president of during my senior year of college. And so that was a separate work study program that, paid us so that we could pay tuition and stuff like that. But I feel like all these both experiences during college is what truly developed me into a well-rounded leader, a servant leader, and someone who can manage teams and manage, interpersonal relationships ever since I was much younger. So Dr. Charles Drew is yet another Black surgical giant who needs no introduction to a lot of us in this room. Despite living a truncated life, Dr. Drew made significant and fundamental contributions to blood preservation and the practice of plasma infusion across the nation. Dr. Drew was born on June 3rd, 1904 in Washington, D.C. as the oldest of 5 children. His father was a carpet layer and his mother was a teacher. He came from a modest environment in a racially mixed neighborhood. As an early display of his mature sense of responsibility, Charlie, as he was affectionately known among his friends, managed the crew of 6 newspaper delivery boys when he was only 12 years old. Dr. Drew was also a stellar athlete throughout his years of schooling. He lettered all 4 years in football and track while excelling in academics at Washington's Dunbar High School. He was actually named the school's top athlete in his final 2 years and went on to attend Amherst College in 1922. And you can see that in the top right picture. He's the red circle. And he was on the same team as Dr. William Montague Cobb, who was a former chair of surgery at Howard as well. The Montague Cobb Society at Howard is also an academic research institution, but unfortunately, I won't be able to cover Dr. Cobb's accomplishments in this talk. Drew was there at the same time as President Coolidge's son was there, and they were teammates. And President Coolidge's son ended up stepping on a nail and got a bad staph infection and ended up dying. And so many people think that this is what catapulted Dr. Drew to pursue medicine. Interestingly enough, by the time he was applying to medical school, the Flexner report had come out. And up until this point, pretty much any school teaching medicine could call themselves a medical school. However, Abraham Flexner, an educator at the time, went around the country and visited medical schools, establishing specific standards they needed to maintain their certification. This resulted in over half of the US medical schools closing. Prior to the Flexner report, there were about 7 Black medical schools. However, after it came out, only 2 remained, Howard and Meharry, between the 1920s and 1970s. So Dr. Drew did not get into Howard or Meharry when he applied, and ironically, they would have allowed him to teach there because of his college education. They would have allowed, they say that he needed 8 English credits to get into Howard, but only had 6, and so they wouldn't let him in. He ended up teaching biology and chemistry for a couple years at Morgan State College and was also the athletics director in 1933. Charles Drew did get into medical school, where, not a US institution, but at McGill in Montreal, Canada. He got his MD and master's in surgery. He also distinguishes himself there as a medical student by winning the prize in neuroanatomy and by beating the top 5 students in an exam competition to win the J. Francis Williams Prize in Medicine. He graduated AOA, and you can see his AOA class photo there, and was second in his class of 137 students. Interestingly enough, being the all-star athlete he was, he also set several track records at McGill as a medical student. And so Dr. Drew had a fairly decorated medical school career, but his interest in transfusion medicine began during his residency at Montreal, the hospital where he was working with a bacteriology professor, John Beatty, on ways to treat shock with fluid replacement. In an attempt to return to the US, Dr. Drew tried to continue his training in transfusion therapy at the Mayo Clinic. But due to anti-Black racism during that time, many of the Black scholars were barred from major academic institutions. He ultimately joined the faculty at Howard University College of Medicine, first as a pathology instructor, and then progressed to a surgical instructor, and eventually he became chief surgical resident at Freedman's Hospital. In 1938, while earning a doctorate at Columbia University, Drew won a fellowship to train in New York with the Dr. Alan Whipple. However, instead of being afforded similar opportunities as his white counterparts to have the full fellowship experience, Drew was denied access to patients and was relegated to work under Dr. John Scudder, who had just received funding to set up an experimental blood bank. Of course, Dr. Drew impressed Dr. Scudder and was called naturally great and a brilliant pupil. This caught the ears of Dr. Whipple, who was eventually won over by Drew and ultimately supported both his surgical training and doctoral research. Dr. Drew's seminal dissertation entitled Banked Blood, A Study in Blood Preservation, made him the first Black American to earn a medical doctorate from Columbia. Scudder described his thesis as a masterpiece and one of the most distinguished essays ever written, both in form and content. Dr. Drew's expertise and key findings in blood storage and preservation resulted in his appointment to head the Blood for Britain project, an effort to transport desperately needed blood and plasma to the UK, which was under attack by Germany. Dr. Drew's work and supervision of the BFB program resulted in the collection of over 14,000 blood donations, and he shipped over 5,000 liters of plasma saline solution to England. This program became a model for the Red Cross, with Dr. Drew as assistant director, that same establishment that excluded Black Americans from donating blood. And even when they later allowed it, they upheld racial segregation of blood, which Dr. Drew openly criticized as unscientific and insulting. One of his greatest innovations were these bloodmobiles that you see on the screen, which was a mobile blood donation truck with refrigerators. His work sealed his reputation as a pioneer and earned him the title Father of the Blood Bank. Another fun fact about this particular time of Dr. Drew's life is that while he was head of the Blood for Britain project, he also took his American Board of Surgery exams and crushed them. In fact, during that time, it is said that in surgical circles, Drew's performance on the oral part of the exam, in which he confidently lectured his examiners about fluid balance and management of shock, became as legendary as his athletic feats had been at Amherst. In 1941, Dr. Drew returned to Howard University, where he remained for the next 9 years, serving as head of the Department of Surgery and chief of surgery at Freedman's Hospital. His mission? To train young African-American surgeons who would meet the most rigorous standards in any surgical specialty and place them in strategic positions throughout the country where they could in turn nurture the tradition of excellence. This, Dr. Drew believed, would be his greatest and most lasting contribution to medicine. Unfortunately, Dr. Charles Drew died tragically in a car accident while driving to North Carolina on April 1, 1950, after falling asleep while driving to a conference to support his mentee in Tuskegee, Alabama. There were 3 other men in the car, 1 faculty member, and Dr. John Ford, one of his interns, and another resident. And although it is rumored that he succumbed to his injuries after ironically bleeding to death because he was turned away from an all-white hospital, I think that has been disproven, and he did receive a blood transfusion, but it was unfortunately too late. I believe Dr. Drew's story and the fact that he had to be twice, 3 times, and even 10 times as good as his white counterparts just to be seen and afforded the same opportunities resonates with a lot of the Black residents and faculty in this room. The idea of having to be twice as good is something we learn from a young age. And while it drives us to be excellent, it also serves as a constant reminder that because of the color of our skin, we may not be afforded the same opportunities as our white counterparts to this day in modern America because of systemic racism. And I know you all may look at me and say, well, Marky, you have it made, you've matched at one of the best, if not the best place for pediatric surgical training, you've won all these awards and you've done all these things. But that internal pressure and that weight on my shoulders has always been extremely high and heavy in order to accomplish these things, because I knew that I had to be twice as good in order to get here. Although I tried to keep Dr. Drew to one slide, it was virtually impossible. The picture in the middle is of Dr. Drew teaching his residents and medical students on rounds at Freedman's Hospital. The picture in the top left is that of the Brits examining bottles of plasma that had been shipped over during the war. And this last picture is of Drew in his football uniform at Amherst College. I actually got this picture off of Facebook where the Omega Psi Phi fraternity posted a picture of Drew, their fraternity brother. And as a member of Alpha Phi Alpha Fraternity Incorporated, the first Black intercollegiate fraternity founded on a cold Tuesday, December 4th, 1906 at Cornell University in Ithaca, New York, it's extremely disappointing that a man of Dr. Drew's caliber decided to become a Q instead of joining the best fraternity known to man. I had the honor of crossing the burning sands into this fraternity on April 3rd, 2021 during my lab years. I am an active member of the Beta Gamma Lambda chapter seated in Richmond, Virginia. I was the 6th and last in line, also known as the tail, ranked by height. And so by definition, I was the rock or anchor of my line and had to watch my brothers' backs. Alpha Phi Alpha's mission is to develop leaders, promote brotherhood and academic excellence while providing service and advocacy for our community. While dealing with some personal and mental health struggles during my lab years, Alpha Phi Alpha was one of my many saving graces. I was able to find community in the brotherhood and was built up and mentored by like-minded, excellent Black men who helped me process and put into historical context the racial and social justice reckoning that was occurring when George Floyd died in 2020. And for that, I'm forever grateful. The next Black surgical giant is Dr. Theodore Roosevelt Mason Howard, born on March 4, 1908. Dr. T.R.M. Howard reached national prominence when he became involved in the Emmett Till brutal murder case. Dr. Howard's journey to medicine and surgery started after he was employed by a Dr. William Herbert Mason, a white doctor for whom his mother was a cook for several years. Dr. Mason recognized T.R.M. Howard's sharp intellect and aspirations to higher education and employed him at the local hospital where he thrived under a variety of jobs. Dr. T.R.M. Howard eventually went on to historically Black Oakwood University in Huntsville, Alabama, with the financial support and formal recommendation of Dr. Mason. He earned not one, but two undergraduate degrees, his second one coming from Union College of Lincoln in Nebraska. It always baffled me reading about these folks, how they were able to travel around the States so easily. But he eventually earned his MD at the College of Medical Evangelists, now Loma Linda University in Loma Linda, California, and graduated in 1942. Dr. Howard was a wealthy and successful entrepreneur and civil rights activist. He was appointed first as chief surgeon at the Hospital of Knights and Daughters of Tabor in Mound Bayou, Mississippi. During his time there, he established several businesses, including a large farm, home construction firm, insurance company, small zoo, a park, a hospital, the first swimming pool for Black people in Mississippi. He also became well known as a leading, illegal at the time, abortion provider and advocate for legalizing prostitution. When Emmett Till was murdered and thrown into a river by a couple of angry white men after being falsely accused of flirting with a white woman, Dr. T.R.M. Howard turned his home in a nearby town into a Black command center for reporters, witnesses, and investigators. Given his outspoken role in the case, T.R.M. Howard was forced to move to Chicago after receiving death threats. He lived out the rest of his years with his wife, Helen Neela Boyd, a prominent socialite, and had to slowly withdraw from the civil rights activities as his health declined and died in 1976. Next is Dr. Myra Adele Logan. She was born in 1908 in Tuskegee, Alabama. She graduated from New York Medical College with her MD in 1933. She then became an associate surgeon at Harlem Hospital, where she spent most of her career. Did you know that in 1943, she became the first woman to perform open heart surgery, the 9th operation of its kind performed anywhere in the world? Dr. Logan was also the first African-American woman to become a fellow of the American College of Surgeons and was instrumental in pushing forward X-ray processes to more accurately detect differences in tissue density, which allowed breast cancer to be identified earlier. Dr. Logan did her fair share of civil rights work like many prominent Black figures of that time. She worked on the NAACP's Health Committee and was a member of the New York State Commission on Discrimination. She was an accomplished classical pianist and retired in 1970. She passed away 7 years later on January 13, 1977, at the age of 68 years old. Dr. Vivian Thomas is probably one of the more consistently acknowledged Black surgical giants because of his close association with Dr. Alfred Blaylock. Vivian Thomas was born on August 29, 1910 in New Iberia, Louisiana. He was a product of the Nashville public school education system after his family moved there when he was a child. He worked as an orderly in a private infirmary in order to save money for college. However, shortly after enrolling as a pre-medical student at Tennessee Agricultural and Industrial College in 1929, he lost all of his life savings in the stock market crash of that year, forcing him to drop out of school. Vivian Thomas never received a formal medical training. 1 year after dropping out of college, he joined Dr. Blaylock's lab at Vanderbilt University as an assistant. Naturally, Dr. Thomas excelled as a research associate and rapidly mastered complex surgical techniques and research methodology. Despite this, Thomas was classified and paid as a janitor thanks to good old institutional racism. Nonetheless, Thomas and Blaylock performed groundbreaking research on hemorrhagic and traumatic shock, which later saved the lives of thousands of soldiers during World War II. In 1941, Dr. Thomas was actually invited to move to Johns Hopkins with Dr. Blaylock when he was offered the position of chief of surgery in order to continue the excellent work they had done in vascular and cardiac surgery. He was allowed to join Blaylock's surgical team at Johns Hopkins and is credited with helping to develop the procedure used to treat tetralogy of Fallot, or blue baby syndrome. What has long been known as the Blaylock-Taussig or BT shunt overlooked Thomas's contributions to its development for decades. However, it is now known as the Blaylock-Taussig shunt and should be referred to as such in honor of Dr. Thomas. When Dr. Thomas performed his first atrial septectomy, his technique was so flawless that Dr. Blaylock, upon examining the nearly undetectable suture line, exclaimed, "Vivian, this looks like something the Lord made." He was hailed as the model of the dexterous and efficient cutting surgeon. Dr. Denton Cooley, renowned surgeon, stated regarding Thomas's technique, "Even if you've never seen surgery before, you could do it because Vivian made it look so simple. There wasn't a false move, not a wasted motion when he operated." Many surgical giants like Dr. Cooley and Dr. Alex Haller credited Dr. Vivian Thomas with teaching them the surgical techniques that led to their success. Thomas was presented with the degree of Honorary Doctor of Laws by Johns Hopkins University in 1976 and remained a member of the medical school faculty from 76 until 85. Because of certain restrictions, he couldn't receive an honorary medical doctorate. After retiring in 1979, Thomas wrote his autobiography and then died at the age of 75 on November 16, 1985, of pancreatic cancer, just 3 days before his book was published. I hope that one day I am described as such a surgeon like the Dr. Vivian Thomas. Not a false move, not a wasted motion. That's certainly the mindset I've tried to maintain in the operating room and one that I've approached with life with as well. It doesn't mean I haven't or won't make allowances for my mistakes, because if one doesn't provide self-grace throughout their journey, then personal excellence and success, whatever you define that as, will become further and further out of reach. The next Black surgical giant is one of my favorites for obvious reasons. This is Asa Greenwood Yancey, who was born on August 19, 1916 in Atlanta, Georgia, to Arthur H. Yancey and Daisy Lois Sherrod Yancey. As a young, brilliant intellectual, Dr. Yancey graduated valedictorian from Booker T. Washington High School in 1933 and went on to attend Morehouse College, where he graduated with highest honors in 1937. He was one of only 4 Black American medical students in the University of Michigan School of Medicine class of 1941. He then trained under Dr. Charles Drew at Freedman's Hospital in DC before becoming chief of surgery at the VA hospital in Tuskegee, Alabama from 1948 to 58. And then went back to Atlanta to become the first Black American physician on staff at Grady Memorial Hospital and served as chief of surgery until 1972 when he became the medical director. His accomplishments continued with him becoming the first Black faculty member at Emory University School of Medicine, where he rose to the role of associate dean, and he also established the first surgical residency program for Black Americans in the state of Georgia. But Dr. Yancey is probably the most known for his modification of the Swenson technique, which involves complete removal of the aganglionic segment of the colon in patients with Hirschsprung's disease, bringing the normal decompressed bowel through the pelvic floor and creating a coloanal anastomosis. The modification of this technique was long credited to Dr. Franco Sove and Dr. Scott Bowley, and for years, the modified Swenson was eponymously referred to as the Sove or Sove-Bowley procedure, where instead of complete resection of the aganglionic segment, one will perform a pull-through of the ganglionated colon through a distal portion of aganglionated demucosalized rectum with the remnant intact muscular cuff, followed by anastomosis above the dentate line. Dr. Sove, an Italian pediatric surgeon, wrote about this technique in his 1964 paper entitled Hirschsprung's Disease, a New Surgical Technique in the Journal Archives of Diseases of Childhood, and traveled the world proposing and speaking about this technique and receiving credit for its conception. Interestingly enough, from a surgical perspective, his original version of the operation was a staged one in that he would leave the aganglionic bowel protruding from the anus without resection. And over weeks, as inflammation caused an autoanastomosis of the rectum, the aganglionic bowel was then removed. Dr. Bowley was the one who turned Sove's stage operation into a single stage one and published on this in 1968. But you see, Dr. Yancey had actually published on this technique 12 years prior to Dr. Sove. Dr. Asa Yancey was a Black general surgeon, not a pediatric surgeon, and he had published his paper in the Journal of National Medical Association, a medium that brought voice to Black physicians and surgeons during a time when there were not that many. In the paper, he described the exact same steps that Sove and Bowley wrote about 12 and 16 years later, but instead it was in an adult patient. Unfortunately, this patient died 9 days later due to malrotation with midgut volvulus, but the coloanal anastomosis was noted to be intact and healthy. In an article recently published in the Journal of Pediatric Surgery in 2022, pediatric surgeons Ken Gao, John Waldhausen, and trauma surgeon and historian Ed Cornwell and others reflected on why Yancey didn't initially receive credit. Juxtaposed against the backdrop of the civil rights movement and anti-Black racism and the limited readership of the Journal of the National Medical Association, there was undoubtedly a component of discrimination that resulted in a lack of credit to Yancey for first conceiving and performing this commonly used technique to treat Hirschsprung's disease. In addition, there was no internet available to readily perform literature searches, and the surgeons would have had to actively seek out his paper. The patient was also an adult, and even though it was being performed for a congenital lesion, it is possible that it did not catch the attention of the pediatric surgery community because they weren't worried about what was happening in the adult population. Lastly, the patient died, and although there's clear evidence that the anastomosis was patent and intact at the time of the patient's death, surgeons who may have heard about the procedure may have not been too keen on reproducing it off of a single case during which there was a mortality. In the last 5 to 10 years, more light has been brought to Dr. Yancey's contributions, and the procedure was officially renamed the Yancey-Sol-Bowley procedure, restoring this Black surgical giant to his rightful place in history. At the age of 96, this giant passed on March 9, 2013, and is survived by 2 sons and 1 daughter. One of his sons, Dr. Asa G. Yancey Jr., was actually at one of the recent APSA conferences during which his father was honored. In the interest of time, I will spend a little less time on the next few giants because I want to get to some of my more modern faves. This is Dr. Jane Cook Wright, born in 1919 in Manhattan to Corinne Cook, a school teacher, and Louis Wright, her father, who was one of the first Black American graduates from Harvard Medical School. Dr. Jane Cook attended medical school at New York Medical College and became chief resident at Harlem Hospital during a time when that was enough of a large feat for a Black woman. She joined her father's cancer research center at Harlem Hospital, where they performed groundbreaking research in using drugs to treat cancer. In the mid-20th century, there was still a lot of hesitancy towards chemotherapy, and it was often used as a last resort. Despite this, Dr. Wright research resulted in her seminal work in 1951, which established the efficacy of methotrexate in treating breast cancer, laying the foundation for treating tumors with chemotherapy. Dr. Wright was an associate dean and professor of surgery at New York Medical College. And appointed in 1967, she became the highest ranked Black American woman at a nationally recognized medical institution. Dr. Wright published over 135 scientific papers while raising 2 daughters, and given the overall influence on the field of cancer treatment, ASCO's Young Investigator Award was renamed in honor of this Black surgical giant. Dr. LaSalle de la Folle Jr. was the first Black president of the American Cancer Society in 1978, and also the first Black American to serve as president of the American College of Surgeons in 2005. Dr. LaFolle was born on May 22, 1930 in Tallahassee, Florida, and raised in the small town of Quincy. His father, LaFolle Sr., was a high school principal, and his mother, Martha, was an elementary school teacher. During his clinical Congress presidential address, Dr. LaFolle stated that as parents, they emphasize that with the good education and hard work, combined with honesty and integrity, there are no boundaries. He held on to this throughout his life, proving to be an exceptional student. He graduated as valedictorian from his high school at 15 years old and summa cum laude in 1948 from what is now Florida A&M University in Tallahassee. And of course, he pledged the Beta Nu chapter of Alpha Phi Alpha Fraternity Incorporated in the spring of 1964. This alpha man and brother of mine went to medical school at Howard University College of Medicine at 18 years old and graduated first in his class. Like many others we've learned about today, he completed his surgical training at Freedman's Hospital and was obviously trained and influenced by the likes of Charles Drew, Montague Cobb, Burke, Mickey Syphax, a surgical oncologist, and Jack White, who ultimately encouraged Dr. LaFolle to complete his surgical oncology training at Memorial Sloan Kettering Cancer Center in 1957. He then went on to serve as Chief of General Surgery at the U.S. Army Hospital in Munich, Germany, and then returned and joined the Howard Department of Surgery faculty as an assistant professor before rising to the ranks of chairman 8 years later. He held that position for 25 years and was named the Charles R. Drew Professor in 1992, occupying the first endowed chair in the history of Howard's Department of Surgery. His teaching honors are literally unmatched in Howard University's 150-year-long history. He received this prestigious faculty award during the College of Medicine's Honors and Oath ceremony more than 30 times, honored with degrees from 14 universities in the US, and held honorary fellowships from 6 international colleges of surgeons. He has published over 150 publications, 3 books, received numerous other national and international honors and awards, and established the LaSalle de la Folle Jr. Surgical Society, established in 1995 to provide funding for student and resident research. Him and his wife's philanthropic efforts even extended to the American College of Surgeons, an organization he was deeply connected to. Of course, behind every great man is an even greater woman. Pictured on the bottom left is Dr. LaFolle and his wife, Ruth, whom he married in 1956. They had 1 son, LaSalle LaFolle III. Dr. LaFall Jr. died in Washington, D.C. on May 30th, 2019, just 3 days after his 89th birthday. Next is Edward E. Conwell III, a world-renowned trauma surgeon and the man who inspired this talk. Born on November 30th, 1956, in Freedman's Hospital, Washington, D.C., he is the son of Edward Cornwell II, a surgeon, and Shirley Cornwell. He graduated Sidwell Friends School and earned a bachelor's in biology at Brown University in 1978, and then went on to attend Howard University College of Medicine and graduated with his MD degree with honors in 1982. He completed his residency in surgery at the LA County USC Medical Center out west, and then completed his fellowship in trauma, critical care, and the administration of emergency management at the Maryland Institute for Emergency Medical Services in Baltimore from 1987 to 89. Dr. Cornwell also married his wife, Maggie Burdett Covington, in June of 89. He trained in cities plagued with gun violence, which quickly made him an expert in treating victims of gunshot wounds and other gory injuries on a daily basis. He began his professional career in 89 at Howard University Hospital before being recruited back to LA County in 93, an elite trauma center that was treating a staggering 1,200 gunshot wounds every year. 5 years later, he was recruited as chief of adult trauma at Johns Hopkins Hospital as they were upgrading to a level 1 trauma center. There, he operated on nearly 300 gunshot wound victims each year, many repeat customers, and nearly a third were young Black men under the age of 19. These experiences caused Dr. Cornwell to become a huge and vocal advocate of violence prevention. He believes that the problem lies in Americans' cultural attitudes towards violence, and stated in 2007 during a question and answer session at Stanford University, and I quote, "Long before Virginia Tech, long before Columbine, we've been a country that glamorizes violence. We live in a culture of violence. Kids from all ages and all backgrounds are inundated with images of violence that glorify it." In 2008, Dr. Cornwell left Johns Hopkins and returned once again to Howard University, becoming chair of the Department of Surgery and surgeon-in-chief at Howard University Hospital. He focused on developing centers of excellence in trauma, critical care, transplant, and cardiovascular surgery, establishing the university as a top training site for surgeons. He remained chair at Howard until 2021, when he was succeeded by Dr. Andrea Hayes Dixon. Dr. Cornwell continues to travel the country, advocating for violence prevention, and most recently gave the Scudder Oration in Trauma at last year's American College of Surgeons Clinical Congress. I wanted to take a quick moment and share these two photos, a collective example of Black excellence. The photo on the left shows the past chairs of surgery at Freedman's Hospital, which later became Howard University Hospital. There you can see Dr. Charles Drew in the second row on the left side, and he was succeeded by Dr. James Laurie and Dr. Clarence Green. Interestingly, Dr. Green was the first Black American board-certified neurosurgeon, and he was chair at Howard for 2 years before dying from a cerebral hemorrhage. He's also pictured on the right here in this suit with a cigarette in his hand. And Dr. Jesse Barber, who was an intern at the time, right here, eventually grew up to become the chair of neurosurgery at Howard. Dr. Cornwell talks about how Dr. Barber was this big, mean, gruff guy, but that somehow he managed to take his daughter, Joy Barber, to prom and definitely got her home on time. This picture is truly a sight to behold. So many great legends and heroes of legends are pictured here. These next few people I will go through rather quickly in the interest of time, but certainly not because they're any less important with regards to their impact on the field of surgery and future surgeons. These surgical giants deserve their own Grand Rounds talk to fully cover their impact and greatness. This is Dr. Andrea Hayes Dixon, professor of surgery and the current and first chairwoman of the Department of Surgery at Howard University. She's also the dean of the College of Medicine there. She did her pediatric surgery fellowship training at 6 Kids in Toronto and was the first Black American female pediatric surgeon to be board certified in the US in 2004. She's a pediatric surgical oncologist and leads a basic science lab that studies rare sarcomas in children. She's nationally recognized for her pioneering work in HIPEC for children, which is originally started when she was chief of the Division of Ped Surgery and surgeon-in-chief at UNC Children's Hospital. Through debulking and cytoreductive surgery coupled with HIPEC, she has single-handedly improved patient survival of the rare desmoplastic small round cell tumor from 30% up to 60%. This next Black surgical giant is a favorite of mine and also a great mentor to a couple of us here in this room. Dr. Henry Ford is a world-renowned pediatric surgeon, prolific physician scientist. He is the current president of the American College of Surgeons, and I had the privilege of receiving the Jameson L. Chasson Award for professionalism from him at the college last fall. As you can see, he also knows Chioma well and has been an excellent mentor and sponsor of hers for many years. Dr. Ford is the current dean of the Miller School of Medicine at the University of Miami, but originally made a name for himself through his impactful research on necrotizing enterocolitis. He has held chief of surgery and surgeon-in-chief positions at CHLA and CHOP, respectively. I could talk for the rest of the morning about Dr. Ford's accomplishments and impact on many surgeons, including Chioma and I, but we will have to save that for another day. What initially drew me to Dr. Ford was his extensive record of service both in the US and internationally, including his home country, Haiti, where he was instrumental in helping to successfully separate a set of conjoined twins on island for the first time in 2015. I hope to one day go back home and have half the impact in St. Kitts that Dr. Ford has had in Haiti. Next is Dr. Ed Barksdale, another pediatric surgeon, hope you're seeing a theme here, and Black surgical giant who you will get to hear from next week during Grand Rounds. He's a professor and surgeon-in-chief at Rainbow Babies and Children's Hospital in Cleveland, Ohio. A Lynchburg, Virginia native and Harvard Medical School graduate, Dr. Barksdale is a leader who currently works at the intersection of academia, clinical surgery, medical education, public health, and social justice. He remains committed to developing programs that help address health disparities in the pediatric population and is the co-founder of the Anti-Fragility Initiative, a novel, holistic, person-centered pediatric violence intervention program funded by the Victims of Crime Act. This is just a little selfie from APSA. I actually chased him down and asked for that selfie. I was a bit of a stalker back then. This next one is Dr. Patricia Turner. She's yet another Black surgical giant who continues to serve at the forefront of the American College of Surgeons. She's a minimally invasive surgeon by training and is the current executive director and chief executive officer of the ACS as of January 1, 2022. Dr. Alice Stanford, the first US-trained Black female pediatric surgeon, the first US-trained Black female pediatric surgeon, because Dr. Andrea Hayes went to Canada because she couldn't get into the US fellowship. She tried about 4 times. Dr. Alice Stanford is the founder of the Black Doctors Consortium that sought to address the disparities in access to testing and treatment of COVID-19 among underserved communities in Philadelphia who are primarily Black residents. She worked with the likes of Dr. Fauci and other local health officials to promote the health and well-being of Philadelphia residents. She was appointed as Health and Human Services Regional Director of the Mid-Atlantic region by President Biden, and since then has channeled her work and passion into the Dr. Alice Stanford Center for Health Equity, a medical center that offers primary care health services to both adults and children in Philly. And I think for me, Dr. Stanford represents the fact that you can do more outside of pediatric surgery and more with your career and still treat adult and pediatric patients and have that impact that you want to have within the community. Last but not least is Dr. Cameron Wilkinson, a close family friend and probably my biggest inspiration to pursue medicine. Dr. Wilkinson was born in Bassier, St. Kitts, just like me. He came from humble beginnings, and I remember my mother would tell me stories about him and his siblings when they would study outside under the lamppost because they didn't have electricity, and how he went on to get the best results in our Caribbean regional exams at the end of high school, which then awarded him the state scholarship that gave him a full ride to study medicine at the University of West Indies in Kingston, Jamaica. Dr. Wilkinson won the prizes for the most outstanding student in surgery and in medicine and therapeutics at the Queen Elizabeth Hospital in Barbados before going on to complete general surgery residency at Harlem Hospital in New York City, winning the program director's prize for the most outstanding chief resident in 1995. When he returned to St. Kitts, he was the surgical giant. As a close family friend and as someone who fixed my inguinal hernia at 12 years old, set my broken leg at age 10, Dr. Wilkinson inspired me to strive for excellence from a very early age. And to this day, I still think about his story as a source of motivation to keep going. He's the past chief surgeon and medical chief of staff of the health institutes in St. Kitts and is the current president of the Caribbean College of Surgeons. After working for 22 years in St. Kitts, he has returned to Harlem Hospital and is currently winding down his practice towards retirement and is spending his free time with his grandchildren, my nephews and niece, who who reside in Boston and Connecticut. And so these are just some pictures when we went to Boston last fall. This is his daughter and her husband. She's a lawyer and they have 2 kids. And this is their youngest daughter, Jordy Eve. So I have some good people to go to Boston to next year. This last slide just shows some of my mentors and giants in their own right. Dr. Kabagamba, I'm forever grateful for you. And I'm so glad that you were able to join this department. You are the first Black female surgeon in this department. And while I know that carries a lot of weight, it is truly inspiring to see you. And we were extremely excited when you walked through these doors. And I hope that you will continue to inspire the rest of us that will come after you. Dr. Chang, Dr. Levin, Dr. McGarren, Dr. Gander, all grateful for you all who've just like influenced my entire residency career. This guy on the top left for you is Dr. Patrick Thomas. And he's a pediatric surgeon in Nebraska. And during my interview at Nebraska, he took the time, that 30 minutes, to just build me up for 30 minutes. Didn't ask me a single question that put me under any sort of pressure, because he recognized what I was dealing with and what I was doing, navigating that path as a Black male. And so he took that time to really invest in me and kind of give me that refresher to continue on through the interview trail. And we've been really good friends since then. And I was able to catch up with him at the college last fall. But I had to highlight him because that's how critical and that's how important it is to pour into us when you have that moment. And that's why I take that extra time to pour into my junior residents and students, especially those who look like me. Dr. Williams, Uncle Mike, goes without saying. He's helped us out in many ways. He's been like family to a lot of us. He's opened up his home to us, even when he wasn't there, for us to throw barbecues and use his fire pit, just serve as a sounding board for a lot of our frustrations navigating this path as Black residents. Dr. Tasha Leon goes without saying, Dr. Sherman, Dr. Friel, Dr. Sung, even in your short time, you've had a major impact on me. And, has re-inspired me, I would say, to pursue that like technical excellence in the operating room. That's something I truly admire about you. Dr. Schroen, you've held me down for years, and you've really backed all of the endeavors, including leading the diversity council for the department and making sure that the demands and the action items that we proposed a few years ago have been put into action. Dr. Yang, you taught me how to administer the best local anesthetic, sub-Q. I promise you, whenever I numb somebody up, they don't feel it after that. So thank you for that, and obviously all the other technical pearls and wisdom that you've passed on. Brandy Edwards and John Davis, Dr. Edwards and Dr. Davis, they were chief residents when I was an intern. And I think they really instilled that culture in our class to look out for the junior residents and get them into the OR actively, and to just really be good people, because residency is hard enough. And so I'm forever grateful for them for making me a strong resident and making my class a strong intern class that we've been able to grow and develop from there and be as successful as we are today. Dr. Hong, grateful for you in more ways than you know. Dr. Brayman, Dr. Hollowell, and Dr. Young, all of you have just really impacted me in many different ways that I've never really verbalized to you all. And I know there are people on this slide that are not here that have also had an impact in my clinical decision making and my technical training. And so I'm just grateful for everyone in this department for all that you've done for me over the last 6.5 to 7 years. Thank you, and happy to take any questions.
Marky, thank you for kicking off the inaugural Chief Resident Talks. These are, my favorite ones of the year by far. And in many ways, I feel like we brought up together. You walked in the doors weeks after I became the PD, and then violence broke out on the street. So you taught me a lot, truthfully, and taught me once again today that history is in the eyes of who writes it, right? And we have to kind of remember that when we're kind of reading history, what that looks like. I've also really loved seeing all the names up there. I see Francis, I saw Lana, I saw Jason, all joining the talk. and realizing that you have people you've influenced that are out, spread out all over the country there. I did have some questions, but I think I probably can't ask them because I think you probably have to get moving. I don't know if Dr. Sun wants to say something too, but I just wanted to say thank you for kicking this off.
I think just because of time, Mark, all I can say is like, wow, it's like, thank you for just going back history. I mean, these are names that, many of us may not have heard of, but through their perseverance, and this is how, you have become a role model because you've seen the past, the difficulties others have made. And I know that you and others in this department will continue to sort of change not only department, but just this American surgery in general, right? So keep doing everything that you're doing. And I'm so proud of, what you've done so far. Thank you. Thank you, sir.
I'll just quickly say thank you so much. It's a humbling talk. And to hear what some of these people accomplished, especially some of these women, I just am amazed. Thank you.
I just have to say thank you for the pediatric surgery group, and we are so looking forward to you moving on and bringing our profession forward. And as some of us are winding down, but it's been wonderful having you here, and we'll enjoy the next few months.
And I want to say thank you for being a great mentor to your juniors and to the medical students, because it's very visible what you do to help other people along, especially those who come from underprivileged backgrounds, to reach their goal.
Thank you, Dr. Kapitan. So just when y'all hear about these procedures and have these talks in the future, just remember that there's some Black surgical giants that influence a lot of what we do today as well. That's the summary. Thank you all.